Okay, overworked, under-resourced and in desperate need of more government support. That's the situation currently facing Victorian regional healthcare workers. An investigation is underway into the tragic death of a 70-year-old man who died on an ambulance stretcher after waiting more than 3 hours for treatment at a regional hospital in Victoria earlier this week. It's the devastating reality of what can and is happening when governments don't plan properly. Joining me now is Rural Doctors Association of Victoria President Rob Phair. Rob, thanks for your time. It's clearly safe to say the system is overwhelmed, isn't it?
We've certainly got a system which is extremely stressed a lot of the time, Cory, and I have to sadly report this is not a new problem. It's been something that's been gradually building, and it's certainly been exacerbated by COVID. And along with COVID, I guess we've had a significant number of people choosing to make a sea change or tree change. So some of our communities are growing quite rapidly. And sometimes the resources that we need to cope with that population growth haven't come along with that demographic change.
Yeah, okay, so you've touched on a number of things there. Firstly, can I deal with the one about COVID? How has that impacted the staffing requirements? I mean, because I know in my home state of South Australia, there's a lot of nurses, medical professionals who are unable to go into the hospital system for one way or another, have been stood down. Is that happening right across the country and is causing this staff shortage?
So I guess the first thing you're suggesting there is possibly maybe related to vaccination. So we haven't found that there's been a large number of staff that declined to get vaccinated. So that hasn't been a major issue for our workforce. But there have been a whole lot of other factors associated with COVID. There's a whole lot of planning involved. There are a whole lot of contingency plans made. And then a whole lot of services were cut back. And then certainly as COVID's gone on, we've had significant issues with both nurses and doctors having to go into isolation or take time off. So even though not all health services have had, you haven't had large numbers of patients you've had to intubate, there's been a major mental health impact on staff members. We've had to treat every patient, for example, in our small emergency departments. Every single patient who has a fever and is unwell, we've had to treat as COVID positive. So our nurses in small emergency departments have also been doing long shifts in full PPE, and we've had to take all the precautions. And then also we have to, in any positive cases we have had, we've had to get out to bigger centres. So it's complicated. It's taken over our lives. We've had lots of regulations and rules which have been rapidly changing. It's been, it's taken a huge mental effort just to keep up with the changes in rules from week to week at times.
And what about then, Rob, the resourcing requirements? Okay, there's never enough money put into health. That's what we're continually told. But in particular, regional health, the regions seem to be neglected in many places around Australia. Is that the case in Victoria?
I think it's true in a lot of places in Australia, Cory, and I guess the rural is a smaller part of the population. I guess there's always been the argument that sometimes we fall in safe rural electorates, so maybe we don't have the lobbying power that some maybe outer suburban seats might have. We're smaller populations, so maybe we struggle to get our voice heard, and often we find that health departments tend to be based in the big capital cities, and you have a bit of an ivory tower effect where certain voices are heard more loudly than others. So I will admit sometimes it's hard to get our point across, but consistently we just have to say that, look, we know that the health outcomes in rural and remote Australians are significantly worse. We get less access to all of the high quality services that are provided in a lot of the big metropolitan hospitals, and so we just want fair access for our communities to good quality healthcare. And really, where rural health advocates are the experts in this field. So what we want is our expertise to be valued in capital cities.
Okay, I've got about a minute before I've got to let you go. Who needs to step up here? Is it a federal issue? Is it a state issue? And specifically, what do you think needs to be done?
So it's not just about infrastructure. It's not just about beds. It's also probably in the first line about workforce. So we need a national strategic plan at state and federal level. And we need workforce plans really that aim to train a future rural workforce by starting locally. We need local students to be recruited into training programs because they will be the kids that grew up in rural areas are the future of our rural workforces. So if a workforce initiative doesn't work, it needs to be evaluated and it needs to be turfed. So it's not always about the money, it's about using the limited resources smartly and re-evaluating incentives, re-evaluating improved pay conditions, industrial awards, and making sure that we offer a better deal in rural areas. So really, to be honest, part of the plan will be to have better conditions in a lot of rural areas that are disadvantaged at present.
You know, that's music to my ears, I've got to tell you, because if a program is not working, you don't just throw more money at it and keep doing the same thing. You've got to use the expertise. You've got to duck and weave and pivot to make sure it achieves the outcomes that it needs. Rob Phair, thank you so much for your time tonight. I really appreciate it and drawing these things to our attention.